Talking about the scapular region, scapula and thorax actually forms an articulation known as scapulo-thoracic articulation, which is actually a functional joint and not an anatomical joint. And for that reason, their muscles become very integral in providing its stability and keeping the scapula in its place on the thorax or the rib cage, and some muscles such as the serratus anterior and the subscapularis. And for that reason, it is very important to understand the muscular structures involved in this area and their actions and their functions. Moreover, muscles are also important because they are responsible for different movements of the scapula on the thorax. And for that reason, in this section, we're going to take a look at those individual muscles, including the trapezius and both upper, middle, and lower fibers of it, also the rhomboids and the levator scapulae, as well as the serratus anterior and pectoralis minor. In this section, we are not specifically going to talk about the subscapularis because it is one of the muscles of the rotator cuff. So we are going to take a look at it when we talk about the rotator cuff in the upcoming sections. But for now, the scapular region and superficial back muscle anatomy, we can observe a lot of these muscles superficially. Just by taking a look at them and by simple observation. So we can look at the upper fibers of the trapezius here, the middle fibers of the trapezius, and the lower fibers of the trapezius. We can also take a look at the deltoid. You can also observe the posterior axillary fold, which actually gives us a little bit information about the superior border of the latissimus dorsi. Here we have the teres minor, which is actually contributing with the latissimus dorsi in the formation of the posterior axillary fold, and we also have the rhomboids here, and then we have the supraspinatus and infraspinatus. If we can palpate the spine of the scapula, superior to it is the supraspinatus and below it is the infraspinatus. So here we can, if we remove the skin and the superficial structures, we can also take a look at them. So here we have the trapezius, upper, middle, lower trapezius, deltoid. Here we have the rhomboids, rhomboid major, rhomboid minor, spine of the scapula, superior to it, supraspinatus, then infraspinatus. Here we have the teres minor. Here we have the serratus anterior because it's usually hidden beneath other muscle structures. And then this is the latissimus dorsi, which actually contributes with the teres major muscle to form the posterior axillary fold. And now let's take a look at them one by one. So here we have the trapezius, the upper trapezius, the middle trapezius, and the lower trapezius. And because they have different actions, we're going to take a look at them one by one specifically. So talking about the upper trapezius. So upper trapezius origin is from the occipital bone, the nuchal ligament, and the cervical spinous processes. And then it comes downward and laterally to insert at the outer third of the clavicle and the acromion process. As it is located superior to the scapula, its function is obviously the scapular elevation and upward rotation. Talking about the medial trapezius, it's in the center of the upper and the lower parts of the trapezius, and the origin is from the spinous process of C7 or the 7th cervical vertebra up till the spinous process of the 3rd thoracic vertebra. The insertion is on the scapular spine, specifically the superior aspect of it, and as it is in the center and its fibers are moving from medial to lateral, so its action is in the scapular retraction, and the nerve supply is by the spinal accessory nerve, which is also known as the 9th cranial nerve, and C3 and C4 sensory component. And the same is the case for the upper trapezius as well. Talking about the lower trapezius, the nerve supply remains the same, but the action, origin, and attachment sites may differ. So the origin is from the spinous processes of the middle and lower thoracic vertebra, and the insertion is at the base of the scapular spine. So you can see that the insertion of the lower trapezius at the base of the scapular spine, the middle trapezius was on the overall scapular spine, especially the superior aspect, and the you can say the upper trapezius was at the other extreme of the scapular spine, which is on the lateral extreme, as well as the acromion process. Now the action, because it is located downward, so its action is in the form of scapular depression and upward rotation. Now, serratus anterior, very important muscle because it is very important in keeping the scapula on top of the thorax, and the origin is from the lateral surface of the upper 8 ribs, and insertion is on the vertebral or the medial border of the scapula and the ventral aspect or the anterior aspect. Moreover, the action of this muscle is in the scapular protraction and upward rotation. So it acts in the upward rotation along with the lower trapezius and the upper trapezius. The nerve supply is by the long thoracic nerve for the nerve root C5, C6, and C7. So serratus anterior, as I already told you, is responsible for keeping the scapula along with the contribution from the subscapularis on the thoracic wall. So winging of the scapula is actually a phenomena which occurs when there is weak serratus anterior, as in pushing against wall with both hands. This causes the scapula to rise away from the rib cage, known as the winging of the scapula, and this occurs when the serratus anterior is weak specifically. Now, talking about the coupling of the serratus anterior, as I already mentioned, it couples with the upper trapezius and the lower trapezius to form a force couple, which makes the upward rotation of the scapula very effective and smooth and efficient. Why is this movement so important and significant? Because upward rotation of the scapula is accompanied with the elevation of the glenohumeral joint. So elevation of the glenohumeral joint means the upward movement of the humerus, which includes two movements, which is the flexion and abduction, and these are the two movements which are involved in most of our activities of daily living involving the upper extremity. So that is why upper rotation is very necessary, and that is why the coupling of these three muscles is very important for smooth and efficient movement of the scapula as well as the glenohumeral movement. Talking about the levator scapula, so this actually has its origin from the transverse processes of the first 4 cervical vertebra, and its insertion or the distal attachment is to the vertebral border of the scapula, specifically the superior between the superior angle and the spine. So this is the superior angle, this is the spine, and this is the ventral border. So it attaches or inserts at the area between the superior angle and the spine of the scapula. Talking about the rhomboid muscles, so there are two types, the rhomboid major and the rhomboid minor, and collectively saying we have the origin from the spinous processes of 7th cervical vertebra to 5th thoracic vertebra, and the insertion is in the medial or the vertebral border of the scapula between spine and inferior angle. So between spine and inferior angle is the attachment site for the rhomboid, and between spine and the superior angle is the attachment site for the levator scapulae. Moreover, scapular retraction and downward rotation is actually the muscles or is the function of the rhomboid muscles, and it is supplied by the dorsal scapular nerve, which has the root value of C5. Talking about the pectoralis minor, it is located on the ventral aspect of the body or the anterior aspect of the body, and the origin is from the anterior surface of the coracoid and the 3rd through 5th ribs. Sorry, the insertion is at the coracoid, and the origin is from the anterior surface through the 3rd through the 5th rib. So you can see this is actually the 3rd, 4th, and 5th rib, and it arises from here and inserts in the coracoid process. And as it is located ventrally and the orientation is also slightly downward, so the action of this muscle is in the scapular depression as well as scapular protraction. Moreover, it is also involved in the downward rotation and the tilting of the scapula. So it is actually supplied by the medial pectoral nerve, the nerve supply for which is from the nerve roots C8 or the 8th cervical and the T1. So that was all about the muscles that are present on the scapular region and their action on the scapula, responsible for different type of movements. And I hope you learned something new out of it. Keep on watching sqadia.com for more lectures like this. Thank you very much.